Experiencing vaginal discharge during pregnancy is normal. Vaginal discharge can vary in color, texture, volume, and odor throughout pregnancy. It can also fluctuate during the menstrual cycle. An increase in discharge is also one of the earliest signs of pregnancy. However, color is one of the most noticeable changes. Most discharge should be milky white or clear and thin, with a mild scent. Other colors, like yellow, green, or gray, can sometimes indicate an infection or other problem. This article covers what the different colors of discharge mean, how vaginal discharge typically changes during pregnancy, and when to see a healthcare provider. What's normal for pregnancy discharge? Normal pregnancy discharge, known as leukorrhea, is usually clear or milky white and thin. It has only a mild odor. It is expected to experience an increase in this type of vaginal discharge during pregnancy. An increase in discharge is often the first sign of pregnancy. Discharge colors in pregnancy and their meaning. When vaginal discharge changes color, volume, or smell, it may indicate an infection or serious health condition. Discharge that requires treatment may appear yellow, green, or gray. Research shows that about half of pregnant people who experience concerning vaginal discharge also report other symptoms like itching, foul odor, pain with urination, painful sexual intercourse, and psychological distress. Clear or milky white. Clear or milky white discharge with no smell is usually considered normal leukorrhea. Normal discharge is thin and does not have any lumps or clumps. White and lumpy. White. Lumpy vaginal discharge may mean that you have a yeast infection. This type of discharge usually resembles cottage cheese and has an off-white color. Yeast infections are the most common fungal infections in the vagina. They occur when there is an overgrowth of Candida yeast in the vagina. Pregnancy raises the risk of increased yeast and yeast infections. Other yeast infection symptoms include itching, burning, and painful urination. Treating a yeast infection immediately is important because an infection can raise the risk of serious complications, including premature birth, low birth weight, and miscarriage. Green or yellow. Vaginal yellow or green discharge may mean that you have a sexually transmitted infection, STI. Trichomoniasis vaginalis is spread through sexual contact. It is the most common non-viral STI and causes yellowish-green discharge, itching, irritation, pelvic pain, and pain with urination. Trichomoniasis vaginalis is treatable and may lead to poor birth outcomes if left untreated. Gray-gray vaginal discharge may mean you have bacterial vaginosis, an infection caused by an imbalance of bacteria in the vagina. Bacterial vaginosis can cause gray discharge that has a strong fishy smell. The smell may become stronger after sexual intercourse. Pink vaginal discharge usually indicates spotting, a minimal amount of blood. Experiencing a few drops of blood from the vagina in early pregnancy can be normal. This may be a sign of implantation bleeding. It is also possible to experience spotting after sexual intercourse or a pelvic exam. Call a healthcare provider if you experience bleeding. Red vaginal discharge is usually caused by bleeding and requires immediate treatment. Possible serious causes of vaginal bleeding during pregnancy include miscarriage, pregnancy loss, ectopic pregnancy. Pregnancy takes place outside the uterus. Molar pregnancy, pregnancy that will not come to term. Subchorionic hematoma, a blood clot between the amniotic sac and wall of the uterus.